Welcome back to Tales of Truth, where we tell the truth about veterinary medicine. I'm Dr. Angie, and this is my co-host, JoJo,
Morning.
veterinary nurse extraordinaire. It is early in the morning. We are recording before the kids wake up because it is summertime, and we are going to take questions from our listeners.
Yeah, this is fun. We had some cat-heavy episodes where we did IBD and kidney disease, and so I reached out to our dog listeners and said, "What do you want us to talk about?" And this is what they want to talk about.
Give the dogs some love.
Yeah, I love the dogs. You love the
Too.
dogs.
I
You
do
just
love
don't
the
live with any
dogs.
dogs.
Not right now. But
Yeah,
can I tell you really quick before we get
yeah,
started?
yeah.
I am really lusting over King Charles spaniels.
Yeah, because they're so cute.
I think they're perfect. I wonder if I am no longer a pug person because I think I've
Oh,
made peace that I'm never going to buy a pug, right? I don't think that we should be breeding pugs.
uh-huh.
And I don't know if I'm going to find one that a rescue that will be right. And so I don't know. I just lust over them. The
Yeah.
Cavalier King Charles Spaniel. Everyone go Google that and tell me how cute they are. 'Cause-
I can see how that would fit into your life.
Right? I feel
I'm
like,
for that.
yeah, so that's my new dream dog. My kids have to be much older and I would have to be in a different situation. But anyways, so
Oh,
maybe I'll
well,
be like a
I'll
catty
throw something
person.
else in there. You know how they say pet parents look like their pets?
Yeah.
You totally have that kind of look.
Do I look like a cabbie?
Yeah,
Because they are
totally.
so amazing.
I'm like, I hope this is okay to say.
Yes. Well, their
Yeah.
ears make them look like they have hair like mine.
Yeah, like hair, like
Yeah.
golden hair.
Yes, they're so gorgeous. Okay.
Okay.
Anyways, tell me all these questions and now because you had to know this about me. You didn't know that I am now a Cavalier person. So,
Okay. Well, now I know. And now
yes,
you know you look like one.
I do.
Okay. Okay. Well, first question is from Jillian. Jillian would love to hear more about how to support dogs who have a very difficult time at the vet due to behavior and big feelings. She wants to know, should say situational drugs be used, and are there some that are better than others? Because she has two of these dogs, and anytime she has to bring them to the vet, she's up all night worrying, and usually comes home feeling like the visit went terrible, and she put the
Oh
whole
no.
office through something hard.
Oh,
I know I
okay.
can relate to this on such a big
Yeah.
level.
These are your dogs.
Yeah, these are my dogs,
Yeah, it's just
100%.
you. Well,
I owe
first I
so many clinics cookies and bagels. And apologies.
totally. Well, first of all, I just want to say there's so many dogs like this out there. There's not a day in practice that goes by where I don't have a dog like this.
Uh-huh.
Like a dog that's reactive. Sometimes they're just aggressive. Like sometimes it's dominance aggression, sometimes it's fear aggression. It's all the aggressions, and it's okay. We are not veterinary professionals for the most part are okay with this.
Hmm.
We have a lot of compassion for your dog and for you.
Oh, we know it's stressful for you.
Oh, it's the worst.
Yeah.
So, yes, on the drugs. Chemical restraint is so great, and I like to use it the night before and the morning of. And so
Uh-huh.
we call it hangover sedation. And it works really, really well. And so there are ways that we can make these visits go much more smoothly. And my favorite cocktail is clonidine, trazodone, and gabapentin. And that sounds like a lot. Like the first time I prescribe that, people are like, whoa, I don't want my dog to be fully sedate. And I'm like, trust me, it's going to be really hard to get your dog fully sedate without injectable sedation. And so, for the most part, you don't need to worry that we're going to like sedate your dog too much or that they're going to die. I've had some people say like, "Oh, could my dog just die from all these?" No, your dog's not. Your dog's not going to die from these types of sedations, especially when we use multiple drugs. We're hitting different receptors, so we actually get to use lower doses.
Uh-huh.
And so, coming from a holistic veterinarian, when people look at me and they're like, "Okay, so you want me to give all three of these?"
It is
Is this,
scary.
yeah, it
Yeah.
is scary. Trust me, none of them are, they're all pretty lightweight. A lot of veterinarians just use trazodone And that is a wet towel.
Or just gabapentin.
Ugh, just gabapentin, also wet towel. Now, if your dog just has some mild anxiety, trazodone, fine. Gabapentin, fine. But if your dog needs to be muzzled, is really reactive, it's not going to do it. And then you're just going to be frustrated. So just start with more than trazodone. It's just not. I don't know. I get irritated when I see that, and they're like, "Oh, well, the trazodone just doesn't work." And I'm like, "Yeah, because it's just one agent by
Yeah.
itself."
Or the gabapentin, which I'm using to treat arthritis anyhow.
I know.
I'm like, he's like barely sleepy.
I know. And I'm a person that takes like half of an Advil, and I'm always the veterinarian that will start in the lower, realm of my dosage range. But for this kind of stuff, I don't do that. I don't.
Yeah.
I start in the middle with 3 different drugs, and it's just, I mean, you and I have done this so many times. Remember when we first started using chemical sedation more, and we'd be like, let's just try the trazodone. And then we would drive out to someone's house, and the dog was like, yeah, you're not touching me. And
Well,
I'm like,
because we saw probably more than the average of aggressive
yes,
dogs because we were a
yes,
house call practice. So these were the people who I can't take exactly what you're talking about, Jillian, where can't take their dog to the vet because it's just so stressful. So house call vets actually can be a win in this area because some dogs do so much better in their home. But I will also notate there are some dogs who actually do worse in the
do
home.
worse. Yes,
And
some do worse. Yeah, and then we would be like, okay, well, let's add some gabapentin. And then we would come back, still not good. Let's add some clonidine, better. And then we were like, let's, up the dosage of all those. And then that's the sweet spot. So I just go to that because we have spent so much of other people's time and money, and our time too, where it's not going to work. If your dog's really reactive, trazodone alone is not going to work, and it's not your dog's fault. They're so, amped up that they just eat through it all.
Right.
And then
they just burn through it. Right. In and out.
yes. Yeah.
Yes. Okay. So chemical restraint is something that you recommend. Can I throw a couple pointers in there too that have really been
Yes.
helpful?
Yes.
Because I deal with this myself. I call the clinic now ahead of time and let them know when Bodhi is arriving and have them clear the lobby for us so we can walk straight to a room, because the less interaction that he has and the less sitting in that waiting room he has with the clinic cat that shows up or or somebody else's dog that would assume he's fair to greet. Let's get straight to an exam room. It just makes that better.
Yeah. Some dogs are so aggressive in the clinic that we will sedate them in the parking lot with an IM, so an intramuscular injection. And that's okay too. That's okay. We will sedate them in your car, and then you will bring them in asleep.
Yep.
And some dogs get all of their veterinary care that way. It is safe. It's okay. And actually, it's way easier on your dog. A lot of people are like, oh, I don't want to put them through that. But putting them through fear is, a really scary situation. And those drugs, I hope this doesn't make me sound like a drug addict, but the more like procedures I've had in my life, like endoscopies and any type of sedation, they feel really good. Like, there's a little narcotic in there. It's a benzodiazepine. It's nice. Like, it's okay. Your dog's having a much better day. Just let it happen. And
That's true. Well, and your dog is feeding off of your stress too. I really believe this is true. So the more relaxed that I can come into the situation, which for me is prep.
Yeah.
How have I prepped? How have I prepped for this? So I have the muzzle on me that fits. And we don't ever have to use that with Bodhi anymore because we've done so many calm introductions that he's kind of cool at the vet now.
Oh.
Yeah.
Good for you.
It's my other dog that has turned into a nightmare. She is a full-on IM sedation situation. But
yeah, and that's okay. It makes the visit more expensive for you. It makes it more of a big deal, but it's not a failure. And, it's okay to use chemical restraint. It's better for everybody.
And I would say with that, in the prep, stack your care. So if you know your dog's going to need to be sedated, do all the things.
All the things.
Do all the things. I was going to say another thing about that. Treats never work when your dog's stressed like that. I'll just say. They have no interest whatsoever. Do the drugs.
They think they're going to die. Like
They,
they're
yeah, they
fighting
are
for their
fighting.
lives.
Yeah.
Yeah. It's so
Yep.
we can help them.
Okay.
Okay, what's the next question?
Oh, I'm going to say one more thing on that too,
Okay. Okay.
because I know I feel a lot of shame
Oh
around
yeah.
that. There is something because I read this in her that how terrible she's feeling about it. I totally get that. It's kind of embarrassing. You feel like your dog should behave better. There's all these shoulds. Go back to our should episode.
Yes.
I mean, shame exists in this, and it doesn't. Nobody there is really judging you.
No.
This is just
No.
your dog. They understand.
Here's one thing we will judge you for. If your dog tries to bite us, if your dog growls at us, if your dog lifts their lip at us, please don't punish that.
Oh
We
yeah,
are so grateful for all of their communication. Don't ever shut down your dog's communication. And I know you want to because I mean it's just reflexive. But if you
hmm
can not do that, please don't because we don't want that. I like it
yeah.
when
That's
dogs
such a
growl at
great
me.
tip.
Yeah.
Yeah,
Please let your
communication.
dog
It's
growl.
our job to listen.
Yes.
It's that is our job. A lot
Yes.
of times when we get bit, it's because we weren't listening.
Yes.
And if you know your dog is a biter or has this fear, maybe has, we try, I love the way you say this, Angie. You say this in a way of, we don't want to add to your, we don't want to give your dog a bite record. Like we just
No.
don't. And
No.
so if you have any inclination that your dog may be in a fear-based state or may need sedation or may bite, just tell us.
Yes.
Like we can approach everything so much more consciously than we may have otherwise. So
Yes. Yeah.
don't hide it.
Don't hide it.
Okay.
Okay.
Next
Next.
one
Yep.
is from Mary. It's another anxiety one, but a different kind of anxiety. So
Okay.
separation anxiety. It seems to affect more dogs than I ever knew. I think people often don't know about it and mistake their dog tearing up things when they're gone as just misbehaving.
That is probably true.
Uh-huh.
Separation anxiety is so common, especially with our COVID puppies.
Yep, that's what I
They,
have.
yeah, they really struggle with that because they
Uh-huh.
were with us all the time, kind of unnaturally. And I would say I like to use pharmaceuticals with a good trainer. So sometimes like something like a Prozac, like an SSRI, can really help decrease stress enough for dogs to learn. I mean, and I'll use clonidine, gabapentin, I'll use all of those things in addition to help the training. But what's really great, the gold, is when your veterinarian or your veterinary behavior expert can be working with your trainer.
Uh-huh.
And that's gold. And so people that have the resources to do that, I feel like have the best outcomes. But there are trainers that will help just with separation anxiety. And you just want to make sure that it's always positive, nothing
Uh-huh.
negative. No negative training for separation anxiety. No negative training for most anything. I'm sure there's some exception that a trainer will, slide in to the comments and tell me about, which is fine. I'm open to that. I'm not a trainer. I'm a veterinarian. But there are ways that we can work together and help your dog. And so drugs and training. And a lot of times you don't have to keep the drugs on board. The drugs often just help your dog learn, takes
Uh-huh.
away some of that anxiety. It's hard to learn when you're panicking.
Right. Well, and I think Mary makes a good point that when your dog is being destructive while you're away, it's not because they're just being a bad dog.
Probably not. No.
They're just needing to move their anxious energy. It's really what that's about. It's like biting your nails or, I don't know, things that we do to self-harm, when
Yes.
we're really anxious.
Yeah.
So, I mean, I think that's, I'm also not a trainer, but I would
Right.
assume it's about moving energy. Like I feel so uncomfortable that this is happening that I need
Yes.
to destroy.
Yeah, it probably depends on like what type of dog, how old the dog is, what like the situation, what are they tearing up,
And
what are they doing?
that is difficult. That is challenging. I know people that feel very just chained to their dog, like they can't
Yeah.
ever leave them alone. So
Yeah,
hard. Acknowledge that
absolutely.
that's hard. Mary also commented that she said also rage seizures. Um, it sounds like something that her dog is going through, something called rage seizures. She's she's like it's very rare.
Yes. I'm assuming what she means is her dog has a seizure when he's mad. Like there's
That's
some
what I
kind of
assume a rage seizure is. Yeah.
yeah. I mean a lot of things can set off seizures. And so I think that rage seizures are probably controlled like any other seizure would be my guess. And I usually use if I have a dog that's just started having seizures, depending on how many seizures we've had close together, I'll start with CBD. So I use the hemp RX. And if that doesn't work, then I'll add on some Chinese herbs. And if that doesn't work, or we've clustered up, meaning that we've had several in a day, then I use anticonvulsant medications. And so
Huh.
that's what I think. That would be my
And,
approach.
well, and this would be a great, I want to make a plug here because
Yeah.
Dr. Angie does do video consultations and to work through, piece through all of these and make a plan. So if that's ever something that somebody could use, we can make plans. You can make plans for
Yeah.
these anxious situations or these dogs that are new to having seizures. There's a lot that
Yes.
we can cover.
Yep.
So
You can go to our website, boulderholisticvet.com, and go to the consultations. You can grab a spot on my calendar.
yeah, do it. Okay, moving on.
Okay.
Okay, Jan wants to hear more about colitis and understands that it can be chronic, but also where to go from antibiotics that dogs can't tolerate. She says, all I know is that prescription food has not really changed anything.
Okay. So it sounds like we have a dog with chronic diarrhea that they have deemed to be in the large bowel, so colitis, that has not responded to antibiotics
Uh-huh.
and a diet change. Does
Well,
that, does
it sounds like the dog can't take antibiotics, not tolerating it. I don't know what that
okay.
means.
So either can't take antibiotics.
Uh-huh.
Well, we don't really know the source of the colitis here. So that's what we would try to figure out. This is a great one for a consultation.
Uh-huh.
But what I will say is, once we've ruled out parasites, we like to do easy things like make sure your dog doesn't have intestinal worms or parasites or doesn't have giardia. So once we've ruled that out, and sometimes it can take a couple stool tests to completely rule that out. Then we start looking for causes. Sometimes it is like a food allergy. So I'll use an amino acid based diet. I've hardly ever had any dog have diarrhea on Ultimino. And so I'll use that if my patient will eat it. And then if that works, then usually it's some kind of like food sensitivity. There are lots of reasons dogs have chronic diarrhea. And then the other thing to do is to check a sample of the tissue. So basically a colonoscopy to see what's going on in there. Why are we inflamed? An abdominal ultrasound would be important. So really we have to kind of get to the root cause to know what kind of treatment.
Uh-huh.
Because if we have an inflammatory process, then a lot of times we need steroids or some kind of anti-inflammatory for the gut. And then if we have food allergies, then we try to figure out, well, what food sensitivity is happening. Some dogs are just like really responsive to fiber. We call that
Uh-huh.
fiber responsive diarrhea or fiber responsive colitis. Like they just need a certain amount of fiber for their colon to work correctly. And so
Right.
those are my thoughts on the few
Okay.
sentences that I have.
Oh, and because it's chronic, we could you rule out that it's like a pancreatic insufficiency, or could it still be a pancreatic
It
insufficiency,
could,
which is a pretty easy fix typically?
yes, yes. And then there's a test for that.
Uh-huh.
Yes, yeah. I
So
would
there's a
say
lot of
pretty rare.
easy diagnostics to start
Yes,
with.
there's some
Okay,
easier diagnostics. Yeah, yeah. We need more
okay,
information.
definitely.
Yeah,
And that would make a fantastic consultation.
totally.
Okay, last one is from Lisa. She says, I wish our vets were more accepting of non-conventional treatments, medicines, etc. For example, pushing vaccines and the like when they should be well aware of the dangers of these toxic chemicals that aren't helping our innocent fur babies. I would like to have an opinion about dogs' well-being.
Yeah. Okay. Well, first of all, what you're saying is so valid. Like basically, she's saying like, why can't I have a conversation with my veterinarian about these other therapies, whether they're herbs or acupuncture or I don't know. I'm not sure exactly what she's referring to, but I could guess.
Uh-huh.
And I think that's a really fair criticism. And I think a lot of pet lovers are feeling kind of isolated and turned off by veterinary medicine right now because they can't have that conversation with their veterinarian. And the reason why they can't have that conversation with their veterinarian is because their veterinarian is not trained in alternative therapies. And
Uh-huh.
so, general practitioners, just to kind of give you the side of the veterinarian, there's so much we're doing. We're your dentist, we're your ophthalmologist, we're your dermatologist. I mean, until we get these specialties on board, we're
Uh-huh.
all of those things. We're your surgeon. We're thinking about so much. We still feel like also we're trying to be like the psychiatrist of like, is your dog anxious all the time? I mean, there's so much happening that a lot of veterinarians don't decide to go learn Chinese medicine or all these, other modalities. So when it comes up, I think a lot of veterinarians just like shut down.
Uh-huh.
And that is unfortunate. But there are some veterinarians that'll be like, oh gosh, I don't really know anything about that, but I support whatever. Like, let me help you find someone who does. And so that's what I can speak to about that piece. Like, she's right. Most veterinarians will shut it down, but most veterinarians just don't have time to know.
Uh-huh.
Um, and in the industry, unfortunately, there's kind of this stigma of like anything else besides traditional therapies has just got to be quackery.
Right.
And so it really isolates people because it's not all quackery, but like some of it is. So I
Well, and
think
I
that's,
imagine it's probably really challenging depending on location to find integrative support because I
yeah.
think we live in the hub of, crunchy granola,
Oh, totally.
I don't
Yeah.
know, the landscape of that. And there
Yeah.
are very few integrative veterinarians, very few.
Very few. Yes.
It's shocking. So I imagine if you live in the middle of Oklahoma or any
Yeah.
of our Midwest states, like where are people going, Dr. Angie?
Right.
How are they getting supported if they've done their research and they found that they don't want to do traditional medicine?
You come hang out with me online. We can meet on
Yeah,
Zoom. That's where you
that's true.
go. Because
So
it's,
really the goal is to advocate because you have
yeah.
a right.
Yeah.
It is your right to advocate for what you want for your pet.
It really is. And I think you deserve to have these conversations. And that's my favorite thing is to tell people like, here are the alternative therapies that are total quackery. Some of it is awful. Some
Uh-huh.
of the information that's out there is awful. It's harmful, but some of it's really helpful. And in my almost 20 years of practice now, it's funny to see the things that used to be like on the fringe are now mainstream. You're like,
Tell
yeah,
me
no,
one.
I told you. Like every hospital I go to now has this herb called Yunnan Biao that we
Oh yeah, we
use.
use that all the
Yeah,
time. Like 10, 12 years ago, but I was at an integrative practice.
you're
And
in
I
an integrative practice, but
I do
now
see it in notes now. I was like, "Oh,
it's everywhere. And
it's
it's
caught
like,
on."
yeah, like 18 years ago, that would have been an underground thing to have.
Uh-huh.
And now there's not a hospital I go to that doesn't have that. And it treats bleeding for
Yay,
dogs with
fantastic.
hemangiosarcoma. Yeah, like it's just caught on. We just all have it now. And so I do wonder what therapies that are emerging now that in 20 years we're going to be like, I told you. I told
Yeah.
you.
Okay, are
So,
they using you now I'm just asking curious questions that
yeah.
listeners may not care about, but the Union Bow, are you using it prior to surgeries?
Um, Sometimes, but we're mainly using it for hemangiosarcoma.
Hmm.
For dogs that are bleeding for that,
Yeah.
bleeding with hemangiosarcoma. And so
Uh-huh.
I think, yeah, I mean, it's caught on and people use it. They'll have it for abdominal surgery.
Uh-huh.
And so, yes, to help control bleeding. And
Yeah.
it's just a classic Chinese formula. And so I do think that there are a lot of therapies out there that were not accepted and now are accepted. And now I wonder what will be accepted in the future as more of a mainstream thing to do. And so
Yeah.
I think it's important that we stay open. But I love having the conversations with people, helping them understand this is quackery, this isn't. Here's what's going to work, because everyone wants to create a supplement and take your money.
Mm,
That is a
that is true
huge
statement.
industry. Yes. And the
Hmm.
marketing is great, and you can get way off track online. And so I can help bring you back.
Yeah, I have
Bring you
found that
back.
in the human side so disappointing as I go through menopause that trusted names that I've followed all of a sudden are selling supplements, and I immediately go into
Right.
can I trust or do I not trust at this point?
And I always look at like how many different supplements are they trying to sell you? Because you
Hmm.
could walk into, and this, I love chiropractors and I go to them all the time, but there are some chiropractors that you walk in, you're like, I need an adjustment, and you walk out with like 20 supplements. That's
Uh-huh.
such a red flag. Why do we need 20 supplements?
Uh-huh.
So when I do my consultations, I try to keep it less than like 3 to 5 supplements. Like, because if we're needing a lot more than that, and sometimes we do, but not very often. And so I think there are a lot of things, and there's a lot of information, especially about vaccines, because we should address
Uh-huh.
her point about vaccines. There's a lot of
Yeah.
misinformation about vaccines.
Uh-huh.
And I think every person should know what diseases their pet is at risk for. What are the consequences of that disease? What's the likelihood they're going to contract the disease? And what's the likelihood that their pet's going to have a negative reaction from this vaccine?
Uh-huh.
Every vaccine should be discussed like that. And unfortunately, veterinarians don't have time.
Yeah. Bottom line.
Bottom line. So call me. Let's talk about it, because
Yeah.
you deserve that knowledge. You'll see people online. When I say people, I won't name any publications, even though I want to. I want to, but I'm not going to do it. I'm not going to start any fights.
Don't
But
make me edit
okay,
extra.
I won't make you edit. Um, People say vaccines last way longer than
Mm,
veterinarians say they do. And you're just like, oh, don't make that blanket statement, because wait, are you talking about a leptospirosis vaccine? Are you
uh-huh.
talking about a rabies vaccine? What are you talking about? Because that leptospirosis vaccine that is given every year, it literally only lasts
Yeah.
that year, because our body's immune system just doesn't make great immunity against bacteria-like organisms like we do viruses. And
Uh-huh.
so just be really careful about what you're reading. And we should probably do a whole episode on vaccines.
Yeah,
I
we could. I know I started thinking of things. I'm like, don't say them, JoJo, hold them.
feel.
Like, 'cause then we're gonna go on another spin.
I know we're going to spin out, and we're
But
probably
my
kind of
my
out
little
of time.
brain wheels were starting to go. Yeah.
Yeah. And so I I do think, to the person that wrote this, I do think you deserve all of these things. I'd love to have these conversations with you. Let's talk about the vaccines. Let's talk about what's right for you and your pet. A lot of it is about risk tolerance and
Uh-huh.
how likely your pet is to encounter the disease that we're preventing.
Yep. And
Yep.
I think that's the whole goal of not the whole goal of consultations, but a large one. I know that your want for people is to feel that they can go in and advocate with confidence.
Yes. Yes.
So when those pressure conversations come, those high pressure situations, the more confident one feels in their answer with the
Yes.
data behind it or the support of another veterinarian who said yes, this is okay. Not just the Google veterinarian that said yes, this is okay.
Right.
So,
Right. Yep.
okay. Okay, that was all of them.
That
I
was
mean, I'm sure
it.
there's others, but those were the ones we're going to get to today.
Okay. And before we sign off, you
Yes.
can definitely sign up for a consultation with me. But if there's something particular you want to learn about, we have courses online.
Mm,
They are recorded courses that I taught live. And we have them like on vaccines, itchy
mhm.
dogs, so many things. I probably won't even remember everything we have a course on.
Vomiting
And
and diarrhea kitties.
vomiting, diarrhea, kitties. Yes, all kinds of things. Parasite control, like flea and tick prevention. And if you use the code Truth Tales, spelled either way, TRUTH THTAILS or TALES, you can get it for free. So
Yep.
go get that. Go get that information and book a consult with me so I can help you out.
Yep.
And as always,
Perfect.
leave us a comment, good, bad, or other.
Yes. Or a like or a follow.
Or a
Would be
like or a
great.
follow.
Follows
Yes.
allow you to get the new episodes when they drop every Friday.
Yes.
So,
Yep.
great.
Okay. We'll see you
Okay.
next
Until next
time.
time.
Bye.
Bye.